Hi, everyone, and thank you for the warm welcome. I should introduce our speaker more often. It feels pretty good. So I just want to say thank you all for being here today. For those who don't know me, my name is Lisa Monkman. I am a physician. I am a mother. I am also married to Wob Kinew. Maybe you've heard of him. So I'm here today to talk about what every single healthcare worker knows. We are in the middle of a staffing crisis. It's been growing for years and it just keeps getting worse. It's really getting harder for us to do our jobs. It's getting harder for us to help people heal. And I want to say to every single healthcare worker out there, I know you're tired and I know you're frustrated and I know you feel like no one's listening to you. So I'm also here to tell you today that you have one important person listening, and that's Wob Kinew. He cares about you. He cares about healthcare. You know, I'll never forget in the pandemic, as we all know, it was a very stressful time. I remember how Wob would watch me get ready for work every day, and how he would look at me with so much love and concern, and also respect in his eyes. And yet he would still wish me well as I left the house, and he would say, "Lisa, I love you very much. You go out there and you save the world." If you elect Wob Kinew on October 3rd, you will have a premier who not only respects and values you, you will have a premier who will listen to you, a premier who will work with you to make healthcare better. I trust Wob to fix the mess that we're in right now. I trust him to take care of us on the front lines. And I trust him to make healthcare better for everyone in Manitoba. But don't just take my word for it. Please welcome my husband, Wob Kinew.
How do you do? I'm Wob Kinew. I'm running to be your premier. I'm asking for your support. I'm asking for you to vote for better health care. Making healthcare better in Manitoba is one of the main reasons I entered politics. I put my name on a ballot to repay a debt that I owe to you, the people in the health system who helped my family so much during my father's battle with pancreatic cancer. Just to let you know a bit about my dad, he was a real old-timer. I remember this one time we were having lunch not too far from here, and I was explaining to him how the brain calculates where sounds are coming from around you by measuring the distance in time between when the sound arrives in your two ears. And he looked at me and he said, "You know, you're pretty smart. You should really try doing something with that." That's how he was. I'm sure you had parents like that too, many of you as well. In 2012, we went through a very sacred experience together. My family and I, we helped my father through the last year of his life. And it was a remarkable journey. We had a chance to say all the things that we wanted to say. We overcame the distance that had existed between us when I was young. And I watched him not just grapple with, but overcome what he had experienced when he was in residential schools. And when he left, just a few days before Christmas, I didn't just lose my dad. After that year that we had spent together, I lost my best friend. And I really wish that he could get to see the stuff that I get to do now, like this. So I will be forever grateful to you, the people who work in our healthcare system, for the way you took care of us, the way you took care of my father. Every step of the journey you were there. You, the cancer care nurses at St. B. You, the MDA employees who dropped the hospital bed off at my parents' house. You, the home care workers who visited. You, the physicians who did house calls. And then you who gave us the palliative care box to take home with us. You were there for him at each step of the way, and you showed us unending grace and compassion and the highest quality care that we could have asked for. And so I want to say thank you. It was in those moments that I formed the belief that you, the people who work in our healthcare system, practice love each and every day. Caring for others is an act of love, and helping people to heal is the highest calling. How could I believe any different being married to the illustrious Dr. Lisa Monkman, family physician? You know, Lisa was there with us on this journey too. She helped to interpret the advice from oncologists, she helped to care for my father, and she helped to lift our spirits when our hearts began to sag. And in the end, she's the one who made the call. She's the one who made the call that my father had left us. So I entered in politics in 2016 to repay this debt, with the idea that I could repay the debt and also help to make healthcare a little bit better. Instead, the PCs formed government that year, and I watched healthcare get cut and made worse. And then the pandemic hit. So to Lisa, and to you, the healthcare workers in this room and across the province, I want to say this. You've taken such wonderful care of us during one of the most difficult times ever to be a paramedic, or a physician, or an x-ray tech, or a healthcare aide. You've taken such wonderful care of us. Now, it's time for us to take better care of you. The staffing crisis in healthcare is the defining issue in the health system today. It will be the biggest challenge for Manitoba's next government. And everything else that we talk about in this election campaign when it comes to healthcare, that will only be possible if we, as the Manitoba NDP, fix this healthcare staffing crisis. On the flip side, if we don't fix the healthcare staffing crisis, nothing in the healthcare system can improve. And this is exactly what will happen if the PCs, under Heather Stephenson and Audrey Gordon, get in for another term. So, here's what we're committing to as the Manitoba NDP. We are going to fix the staffing crisis. We are going to repair the damage that the PCs caused with their cuts, and we will set the stage for the future of our healthcare system here in Manitoba. The first target we will hit is to hire 300 nurses to make up for the 300 nurses that the PCs cut in the city of Winnipeg alone. We want to do this in 2 years, and we will make an equivalent commitment to rural and northern Manitoba within a first term. And we will keep hiring nurses after that because we need more working at the bedside to fix our healthcare system. Hitting this initial 300 nurse target is just the first step. We also commit to Doctors Manitoba's target of 400 physicians over the next half decade. We will hire more paramedics in rural Manitoba. We will hire home care staff and people to work in personal care homes so that seniors can live independently and age with dignity. And by the way, more home care staff and personal care home workers will help to alleviate the strain on our emergency departments and in our hospitals. To accomplish these goals, today our team is committing to investing $500 million of new money towards fixing the healthcare staffing crisis in Manitoba, starting with that goal of 300 nurses. This is $500 million over and above what the PCs are promising over the next term in government. So, those are some numbers and those are some targets. How are we actually going to do it? 3 steps. 1, we need to plug the hole in the bottom of the boat. That's retention. 2, we need to bring in the reinforcements. That's recruitment and training. And 3, we need to look to the future and set clear long-term goals for our healthcare system here in Manitoba. When I say plug the hole in the bottom of the boat, what I mean is we need to stop losing people who are working at the bedside right now in Manitoba. And this needs to be job one. Right now, under the Conservatives, we continue to see people retiring, leaving their professions, leaving the province. If we don't address retention first, we can add all the new healthcare staff that we want, and we will simply be setting them and ourselves up for failure. We would only be inviting these new recruits to join a broken system and experience the same burnout and the same poor working conditions, and then watch them leave the system a few years later. So we've got to fix the hole in the bottom of the boat first. Our public health care system is taking on water. And what we're saying, let's fix the leak. What the PCs are saying is, let's abandon ship. They want to privatize, and they want to abandon public health care in Manitoba. But that's not who we are as Canadians. Universal public access to health care is a fundamental Canadian value. We're not going to take an ideological approach. We will use fee-for-service and existing approaches where it makes sense, and we will continue to invest in our public health care system along the way. But bottom line, we will never abandon ship. About 10 years ago, I was working part-time in the States, and I asked Lisa if she wanted to explore the possibility of working down there too. And she said very clearly, no. I will never work in a health system that lets people die on the doorstep of a hospital simply because they do not have health insurance. And I had stars in my eyes, and I said, will you marry me? So how do we fix this hole in the bottom of the boat? Well, we need to bring better working conditions and work-life balance into the healthcare system. We also need to bring in financial incentives, along with a good wage, but financial incentives that get people to work in the areas of the healthcare system where we need them. Primary care health teams being one example. So yes, we are committed to investing more in healthcare in Manitoba. But I also want to make something very, very clear here today. The change we seek is about more than just spending more money. If we keep putting more dollars into the same old approach to healthcare here in Manitoba, we will not get the results that we need. We need a new culture in healthcare here in Manitoba. In order to improve retention, we need to overhaul the healthcare system leadership here in Manitoba and implement a new leadership culture that has more emotional intelligence. How many times have people from the front lines spoken out under the PCs? It began under Brian Pallister, but it's continued under Heather Stephenson. Doctors spoke out under Mr. Pallister, and the PCs said that they were causing chaos. Nurses wrote letters, and the PCs said that these letters were made up. They said the same thing about surgeons. Now, the nurses and physicians who've spoken up are coming from every hospital in the city and from every health region across the province. What has been the common refrain? They've said time and time again that senior health system leaders and elected officials are not listening. These frontline workers have said, we have solutions to the problems, and we are being ignored. This has to change. We need health system leaders who don't just bring commands down from on high. We also need health system leaders who bring local solutions back up the chain. You know, the experts in healthcare burnout say that when management doesn't have emotional intelligence, you see more people leaving the workforce and more people taking sick leave. We need leaders who can listen, who can compromise, who can motivate, who can work with you, the frontline healthcare heroes. In short, we need health system leaders who can lead and who show you respect. So, our team will say to those who run the healthcare system in Manitoba that if you can't deliver on reducing wait times and on improving staff morale, then we are going to find people who can. So we need a new culture in Manitoba healthcare that is flexible and supportive for the people in scrubs who deliver care and demands accountability for the people in suits who run the healthcare system. I'll say this again. We need a new culture in healthcare that is flexible and supportive for the people in scrubs and demands accountability for the people in suits. And that includes people such as myself, the elected officials. You need to hold us accountable to deliver on healthcare. The second plank in our plan is recruitment and training. We need to bring in the reinforcements. So we need to train more health professionals, doctors, nurses here in Manitoba, and bring as many as we can in from other jurisdictions and get their credentials recognized quickly. We'll work with the healthcare unions to do this in the right way. One thing we will never do, though, as part of our hiring initiative, will be to pit healthcare workers against one another, as this current government has. One of the biggest mistakes that Brian Pallister and Heather Stephenson made during consolidation, and there were many of them, was to delete everyone's jobs and then force them to reapply in order to keep working in the same positions. This created scenes like the one in the tunnels of the HSC. There, amidst the concrete and the pipes, nurses, aides, and staff had to trudge down into the bowels of the Health Sciences Center, and there, everyone's jobs, which had just been deleted, were now reposted in 8.5 by 11 paper on the wall. No privacy, no method to the madness, just a free-for-all. These workers had to go and rush and sign up for their old jobs in front of each other. They had to jostle with one another to write their names on these pieces of paper. This forced colleagues to become competitors. It left some people on the outside looking in, and it showed absolutely zero respect for those who take care of us. This can never happen in our healthcare system again. However, scenes like that will be repeated if the PCs get another term in government. After everything we've seen for the past 7 years, what makes you think Heather Stephenson won't cut health care again? And so our team is proposing a better approach. The bottom line is we need to bring in reinforcements as soon as possible, and we need to treat them well. And we need to treat our existing healthcare workforce, you the people in this room and across the province, better. I believe this message that the reinforcements are coming will help with retention too. This brings me to the third plank in our plan, setting a course for the future. So think about it right now. We've got a major healthcare recruiting challenge here in Manitoba. Like, imagine for a second that you are that young person considering a career in healthcare. What's our job offer to you right now? Come work in healthcare where you're going to be stressed out and burnt out and mandated to work overtime and disrespected by the government that employs you? Certainly we can do better than that, especially as we compete against other provinces. So we need to build a health care system that is focused on Manitoba's future, that improves patient care, while also inspiring young people to answer the same calling that you have. One way we will do this is by investing in new healthcare centers of excellence. These will be clinician research chairs funded by our team that will allow us to recruit new Manitobans or develop homegrown talent who will be rock stars in our healthcare system. We will aim these at the areas where our people in this province need them: multiple sclerosis, juvenile diabetes, cancer care, Indigenous health, women's health, cardiac care, and more. These clinician researchers will deliver excellent patient care while conducting cutting-edge studies, building teams of people around them who are just as passionate about solving healthcare problems as you are. This will help broaden the conversation about healthcare in Manitoba beyond just being about fixing the current crisis, and also start to include some big dreams about a future healthcare system in Manitoba focused on excellence. Then, our recruiting pitch to that young person here in Manitoba might go something like this. If you want to work in a personal care home to provide comfort, dignity, and good food to the elders who built this province, come join us. And if you want to pursue scientific breakthroughs that make this world a better place, you can do that here too. I mentioned we are competing against other provinces right now. So even as we speak, big provinces and even our neighbor to the west are poaching our talent. And let me be clear, we need to get in the game. However, I also want to flag that if provinces keep competing against each other in this way, we will create winners and losers. And we may end up racing one another headlong into a future where no province in Canada can adequately staff its healthcare system for the long term or afford to do so. As a result, our team will be a strong voice at the national level to ensure there is a nationwide healthcare staffing strategy. By leading this conversation, we can help to ensure that Manitoba gets its fair share of staff, and that you, the people who are the healthcare staff, this healthcare workforce, that you are treated with respect. So yes, to health workers across Manitoba, you have taken care of us. And with these three planks on retention, recruitment, and preparing for tomorrow, we are going to take better care of you. So I began the speech by talking about the end of life. But the other truly sacred time in our lives that the healthcare system is there for many of us is when we welcome a life into this world. And here, Lisa and I have been lucky to get excellent care as well. You know, about 5 years ago, we welcomed our youngest into this world. And not too long after that, Lisa's sister also welcomed a baby into this world. And she brought her newborn over to our house just a few days after he was born. And so the public health care nurse came to check up on them when they were over at our place. So I was sitting there with Lisa's sister, Tara, and then this amazing, super energetic public health nurse comes in. And she looks at Lisa's sister, who is the same age as me for the record. She looks at Lisa's sister, "Oh, wow, so beautiful. Look at Mom." And then she turns to me, and then she goes, "And who's this? Grandpa?" I'm sitting there like, we were born less than 3 months apart. What do you... Well, what I'm trying to say is it was a joyous time, is what I'm getting at there. And, yeah. But sadly, not every family in Manitoba has the opportunity to savor those sorts of moments. And so I want to reflect on this as well. And in particular, I'm going to propose to you today that as part of solving the staffing challenges here in Manitoba, we need to reset the relationship between healthcare staff and government. And I don't just mean setting a different tone when we walk into meetings together. I think that in order for us to truly reset the relationship between staff and government, we should agree on a common goal for our healthcare system. We ought to adopt this shared mission for our healthcare system, for our society, for our next government, so that we can return to it for motivation when the going gets tough. We should use it to remind ourselves of the need to work together when unforeseen challenges inevitably arise. So, what should this shared mission be? Well, I'm sure you didn't enter healthcare just to improve the healthcare system. You entered healthcare to make lives better. So we need to focus not only on trying to move health system indicators, things like patient flow, we should also focus on making Manitobans healthier. So, which statistics should we choose? Which indicator should we pursue? When you look at the challenges today, with respect to the health of Manitobans, it can be very daunting. Could a provincial government move the rates of hypertension and heart disease, even over a few decades? I hope so. Could we lower rates of diabetes, including juvenile diabetes? Well, we certainly have to try. These are generational challenges. They're tied up with smoking and diet, poverty and trauma, big corporations, and small-town life. Now, I want to move the needle on all of these challenges, but there is one in particular that I want to zero in on, that I believe we can move after a few years of persistent effort. Now, this one that I'm going to propose as our shared mission, it may not be the first one to come to mind, because we don't talk about it nearly enough. So what is this health outcome that I think we should adopt as a shared mission? What is a statistic that I believe that we should pursue together? More kids in Manitoba seeing their 18th birthday. It's true that things are slowly improving in this area over time, but in my estimation, they're not moving fast enough. We continue to rank behind every other province. Manitoba is in last place when it comes to the most important thing: kids. Not only is it sad on a human level, it's also a symptom of a society that is unwell. Making sure kids grow up healthy and strong is just something a healthy society does, and we need to do better. So I want to say to you today that if we are elected government here in Manitoba, not only will we fix the staffing crisis, but we are going to move heaven and earth to bend the curve when it comes to child mortality in Manitoba. We know where these problems are happening. You are the people who have to bear witness and respond when these tragedies occur. And we also know that there are concrete things that we can do to address them. So let's take action together. You and people like you have held the babies born with low birth weight. So let's double the prenatal benefit. The evidence clearly shows that this program increased birth weight in Manitoba. You have been the first responders on the scene to house fires where there are children inside. So let's make sure there's a smoke detector in every home in this province, including on reserve. You've been in the ER when kids are brought in after car and ATV accidents. So let's ask Manitoba Public Insurance to dive deeper into the data that they have about where these accidents are taking place, and then let's invest in primary prevention. You and your peers have run the tests that show that babies are being born in this province with STBBIs, like HIV and syphilis. So let's bring in a real plan to end chronic homelessness, starting with children and pregnant mothers. Let's connect them with primary care and prenatal care and give them the medication that prevents babies from being born with HIV and syphilis. These conditions are entirely preventable in a rich country like Canada. And when it comes to the epidemic of suicide that is present in so many communities across this province, I can only imagine the toll that it's taken on you, the people who have to respond and care and talk to families. I can only imagine the toll it's taken on you because I know the toll that it's taken on me. So for God's sake, let's not just show up for a few days after these incidents happen and then leave. Let's instead launch a province-wide, comprehensive suicide prevention strategy aimed specifically at young people. And this strategy should have a particular focus on Two-Spirit and queer youth in our province. Moving the needle in these areas will hopefully make things better for you at work. It will also help forge a shared mission for you, the healthcare workforce, and our government, should we get the chance to serve. As part of resetting the relationship between our healthcare staff and government, let's buy into this goal together and work towards something we can all agree on: doing better for our kids in Manitoba. So yes, we want to plug the hole in the bottom of the boat and improve retention. We need to bring in the reinforcements by accelerating recruitment and training. And we need to inspire the next generation by investing in healthcare excellence. But along the way, if we can do all those things and implement the program that I'm talking about here so that in 6 years or 8 years, more kids in Manitoba get to see their 18th birthday, I think everyone's going to feel pretty good about that. And a reason like that is the reason I believe you joined the healthcare system. And a reason like that is the reason our team has worked tirelessly to hold the current government to account. And a reason like that is the reason that I am running to be our premier. So in addition to the offers that I'm making on retention and recruitment and planning for future healthcare excellence, I want to make the offer that we work together on this goal. A goal that is bigger than any of us alone. The path ahead of us will be difficult. The goals that we're setting are very ambitious. So I believe we need this North Star. We need this guiding light to return to when the going gets tough, so that we can keep moving forward together. So if our team prevails in this year's election, then let us agree on this mission for healthcare in our province. More kids alive to see their 18th birthday, not just more of the same. Let's make life better together.